So thank you so much for having me tonight. I am very, very excited to talk to you guys a little bit about what I do in my practice, the conditions that I treat, and of course, talking about this hot topic of snoring. So snoring is definitely not normal. It's a sign of a much bigger problem. And, we'll talk about obstructive sleep apnea because that is something that I see every single day in my practice. And a lot of people don't even know that they have it. And if they do have it, they don't really understand the diagnosis. So I'm very happy to be here tonight. So at the Pain and Sleep Therapy Center, we are an airway-focused integrative center for health and wellness. And really our mission is to improve the quality of life for all patients by discovering the root cause to help reduce pain, enhance sleep, increase energy, and promote healthy growth and development. So I would like to introduce you to the other providers. This is Dr. Ryan Robinson. He is actually the founder of Pain and Sleep, and he started the practice in Newark, Delaware. He is an innovator. He is always keeping up with the latest research when it comes to airway, breathing, and of course, TMJ disorders. And this is the wonderful nurse practitioner, Rachel Reynolds. She is just a wealth of knowledge. She's probably the smartest person that I know. And to be able to collaborate with her on a daily basis, I just feel very lucky that she's part of the team. So we were able to open up our second location in Pennsylvania. So this is the office information. And this is my email address. So if anybody has any questions, I love helping people, guide them, definitely, to help them, especially if they're having pain. So please take my email address and reach out to me at any point. So a little bit about me, that is my dog, Matza, and I am originally from St. Petersburg, Florida. And I did my undergrad and dental school there until I decided to move to New York City, where I did 2 years of a general practice residency. And after I graduated, I started working in general dentistry, and I was really enjoying it, but I was seeing a lot of patients that had a lot of TMJ pain, clicking, popping, limited opening. They were clenching and grinding at nighttime. They were breaking teeth, and I didn't really know how to help them. And really the only thing that I could do is make them a night guard. Unfortunately, most of the time they were not getting better. So it wasn't until I heard a lecture by Dr. Robinson about snoring and sleep apnea and the role that dentists have in screening and treating this. So when I went back to my practice, I started screening all of my patients for snoring, breathing, any kind of airway issue. And I noticed that there was a huge connection with these patients that were having a lot of jaw pain. They were clenching and grinding. So I really just went out there and I started training myself. I learned everything that I could, and it really has become my passion to help patients breathe better in order to optimize their health. So the top reasons patients are referred to my practice, they already have a diagnosis of sleep apnea, but they are not able to tolerate their CPAP. They snore, they have poor sleep, they need an upper airway evaluation, they have a lot of migraines, they have a lot of facial pain, jaw pain, they can't eat, teeth grinding, tongue tie, lip tie evaluations, and of course myofunctional therapy, which I will talk a little bit about today as well. So I probably say this like 15 times a day in my professional and in my personal life. So snoring is common, but it is not normal. We unfortunately have And our society made this a little bit of a joke when you see it in TV shows or movies, or, my dad, he shakes the house, he snores like a bear. But really, it is an alarm that something is happening. So we can all agree that breathing is really important and we need to breathe to survive. So if there's something happening within the airway that's causing the reduction of airflow, I think we really need to make it more of a priority and an urgency to figure out what's happening. So that's really my mission, is to evaluate anyone who's snoring, to dive a little bit deeper and figure out what's happening. So what exactly is snoring? I'm sure we've all heard the sound of it. So it is the harsh sound that occurs when air flows past relaxed tissues in your throat, causing the tissues to vibrate as you breathe. So primary snoring without obstructive sleep apnea is estimated to affect between 20 to 40% of the general US population, with about half of these people reporting it as the cause of problems with their bed partner and in social situations. So I have a ton of people in my practice that unfortunately they're in a sleep divorce. They sleep in separate rooms because they're not able to have, they can't sleep, right, when one person is snoring all night. So just because someone is snoring, it does not mean they have obstructive sleep apnea. But if you have obstructive sleep apnea, your 94% of people will snore. So with that alone, I think anyone who snores needs to be evaluated. So when someone is laying down at night, you can see that this person right here, he is sleeping really well. The air is going up his nose, down his throat, and into his lungs. His mouth is closed. You can see that his airway is nice and open. So if you focus on this area right here, this happens to be the narrowest part of your airway. And you have the uvula, which is part of your soft palate. You have your tongue, and you have the back of your throat, all competing for the same space. Okay, so it's really important that everything stays forward. Unfortunately, this person on the right, he is not sleeping well. You can see that the mouth is falling open, the lower jaw is falling back, the tongue is falling back. So as the air is flowing down the throat, as it passes through this narrow opening, it's causing the uvula and the soft tissues to vibrate. Okay, so there's some restriction happening. So if you look at your airway, it runs from the tip of your nose all the way down to your throat. And there's 4 points that can cause an obstruction. In our practice, we do a very thorough evaluation and we identify where the patient is having a problem. So that's really, really important to identify the root cause as to what is happening, so that way we can help fix them. So I always like to mention this big, beautiful muscle right here. It is your tongue. It sits in your mouth, and you can see that the back of the tongue can influence your airway. It can influence your breathing. So it is really, really important that we evaluate the tongue, right? Which a lot of people don't do. In our practice, we look at the tongue, we look at how big is the tongue? Does it have enough space in the mouth? Where is it sitting in the mouth? That is really, really important to identify. So even though the tongue is attached to the lower jaw, the parking spot for your tongue is suctioned at the roof of the mouth. And that's where your tongue should be sitting during the day. And that's where your tongue should be sitting at nighttime. So there's a lot of reasons why someone's tongue sits low, whether it's a tongue restriction or just a low tone tongue, but that's something that we look at in our practice. So I want to show you that snoring is just one part of an entire spectrum of obstructive sleep disordered breathing. prior to snoring, there are signs that there's a problem. And I see a lot of patients that are mouth breathers, or they have upper airway resistance, but they're not really snoring, right? So just because they're not snoring doesn't mean that there's not a problem. But when the snoring happens, it means that the patient has moved on, right, down the spectrum. Once snoring, you start to hear it, especially consistently every night. If you don't address it, it will then move forward into becoming sleep apnea. So definitely it's an alarm that something is happening within the airway and it needs to be evaluated. So let's talk about obstructive sleep apnea, because it is a very serious sleep disorder in which the breathing stops and starts throughout the night. And there's many different types of sleep apnea, but the most common type is obstructive sleep apnea. So it's when those throat muscles that we talked about in the previous slide, they relax so much that they're actually blocking airflow. Okay, so you can see that the soft palate, the tongue just goes back completely. What happens, unfortunately, as someone stops breathing, and it can be 10 seconds, 15, 20, I mean, people can hold their breath for a very long time when they're sleeping and not even know it. But then the body is going into a sympathetic response. Cortisol is being released, and then that's when people are gasping for air at night. I see this a lot, and these patients don't even know that it's happening. They are very lucky that they have a sleep partner that can tell them that this is happening. So usually I have a bed partner dragging them into my office saying that there's something going on. So this is actually really scary, because about 30 million Americans suffer from obstructive sleep apnea, yet only 6 million people are officially diagnosed. So that means 80% of people with OSA are undiagnosed. So it is my mission to help as many people as I can. So what are signs of sleep apnea? Loud snoring, gasping for air during sleep, morning headaches, especially behind the eyes, excessive daytime sleepiness, insomnia, difficulty concentrating, memory problems, dry mouth or sore throat after waking from sleep, and having to wake up a lot to go to the bathroom throughout the night. So we were talking a little bit about the tongue. So think of your tongue as an on-off switch for nasal breathing. When the tongue is sitting low in your mouth, it's going to promote unhealthy breathing through the mouth. When the tongue is resting up at the roof of your mouth, it's going to facilitate healthy nasal breathing, okay? It's also very important, especially for children, that the tongue is up at the roof of the mouth, because as the jaws are growing, it's going to grow around the tongue, okay? So for every child that comes to our practice, we help them get their tongue up. Very, very important. So nasal breathing is the only way that you should be breathing. When you breathe air through your nose, you are purifying that air that goes out into your body. The oxygen is going to be absorbed more efficiently when you breathe through your nose. It's going to put you in a parasympathetic state, reduces blood pressure, stress, leads to better performance during exercise, and leads to 10 to 20% more oxygen uptake. Mouth breathing is unhealthy breathing, and it actually makes everything worse. Asthma, high blood pressure, heart disease, and other medical problems. You're more susceptible to common colds and infections. It's been linked to ADHD and learning difficulties, and it causes improper growth of the face, because if you are mouth breathing, your tongue is not at the roof of your mouth. So then your jaws, it has nothing guiding it, right? So think of your tongue as a natural palatal expander. And it also is really bad for your oral health because it can contribute to dental decay and gum disease. So when I ask my patients in the consultation if they can breathe through their nose, most of the time they say, yes, I can breathe just fine, because that's the way that they've been breathing their entire life. But when I take a scan on them in my office, you can see that, so this is the internal complex of the nose. You can see that the septum is deviated. And I really want you to focus on black space, okay? So look at after surgery, look at all this healthy breathing space right here, okay? So when we help them, guide them, and whether it's surgery or we help them with more conservative measures with reducing the inflammation of their nose, they can't believe that they've been breathing a certain way their entire life. So these scans are very, very helpful because we can look at the anatomy of everyone. Some people are more predisposed to having airway issues because they have all this blockage, in their nasal cavity or in the back of the throat. So I want you to appreciate the difference of this restricted airway. This is a side profile of someone, the nose, the lips, and the chin. Okay, this is the throat, this is the cervical spine. Obviously, there's a huge difference with the airway space, okay? So this is actually one of my patients, and he came to me with jaw pain, okay? He just could not eat. We took a scan on him, we did a workup, we evaluated his airway, nose, breathing, and we got him a sleep test, and he stops breathing 15 times an hour, and he had no idea. And then when I started asking more questions, his wife did say that he gasps for air sometimes, and he also has a history of a heart attack, and he's a young guy. So if you imagine he's sitting up and his airway is this small, think about when he lays down, right? Just like that other slide we were looking at, the moment his tongue falls back, he has an obstruction going on. So after treatment, he's doing wonderful, no pain, he's actually sleeping better. And the reason why his jaws were so bad, they were so painful, because he was clenching and grinding so much, and that's because his body was trying to open up his airway at nighttime, okay? So clenching and grinding has been connected to airway obstruction. So just like, think about that tongue falling back, it's attached to the lower jaw. So when your body is recognizing an obstruction, it's going to cause your body to go into a sympathetic response, and it's going to activate your facial muscles to try to shoot that tongue forward, okay, by clenching forward. So we, thankfully he did come to me so we could find this much more serious disease. So this is always fun to do. You can download an app called the Snore Lab app, and it will actually record you at nighttime, and you can hear if you're snoring, and it will measure the intensity and the frequency, and you can use it for multiple nights. And so the average user scores around 20, while a score more than 100 puts you in the worst 15% of snorers. So we use it as a tool, especially when we start treating our patients and we want to monitor if their snoring is improving. So there's a lot of great home sleep tests now that makes it really, really easy for patients to get tested. And not just for sleep apnea, we're able to get a lot from a sleep test. So we work with a lot of sleep physicians that will send a sleep test to our patient's house. It's very, very useful. So in my practice, I treat snoring and sleep apnea by using an oral appliance. And really what that's doing, it's moving this lower jaw forward, right? So it's moving the jaw forward, so it's keeping the tongue out of the airway. But remember, it's not just about putting an appliance in someone's mouth. It's about helping with nasal breathing. It's about keeping that mouth closed, and not one size fits all. There's a ton of different sleep appliances out there. So I see a lot of patients coming with Amazon appliances or stuff that they made themselves. And that, maybe holding their jaw forward, but it's doing damage, a tremendous amount of damage to not only their jaw joints, but their muscles. Okay, so it's really, really important to get a full evaluation to get into the right appliance. And there's over 200 different types of appliances, and we use a lot of different ones, either for sleep apnea, snoring, or TMJ disorders. So myofunctional therapy is absolutely wonderful, and I think everyone should do it. It's the treatment of the facial muscles to improve the muscle tone and establish correct functions and control of the tongue, lips, and lower jaw. So essentially, for a lot of my patients, especially with snoring and sleep apnea, we give them tongue exercises to really get that tongue to the roof of the mouth, right? To try to, establish a proper oral posture. It's very, very helpful in children because we have to get that tongue up so that the jaws will grow properly. So the tongue is a natural palatal expander, and it can absolutely influence the development of the jaws, the teeth, and most importantly, our airway. So we got to get to these children. Okay, so after today's lecture, I want everyone to know what a healthy resting posture is. So your lips should be closed. You should be breathing through your nose, and the entire tongue, not just the tip of the tongue, but the back of the tongue needs to be resting at the roof of your mouth, and the teeth should be slightly apart. So I know a lot of people walk around clenching on their teeth all day, but your teeth should never be touching. So just keep that in mind. So the question is, how early do we start? As soon as there are symptoms. The moment a child is born, they need to be looked at for a tongue or a lip tie, right? Are there feeding issues? Feeding issues usually are the first sign of a tongue oral restriction, okay? And that has to be evaluated. And then the child needs to be watched as they grow, right? Are they clenching at night? Are they snoring? None of that is normal. I hear a lot that they're told that they will grow out of it, okay? We got to get to children early. There's really no time to wait for them to grow out of something. So the way that we think in our practice is, let's, figure out how to get the smoke away before it turns into a fire, okay? So unfortunately, in my practice, I see a lot of adults, and by the time they see me, they have a lot of pain. They can't sleep. They have obstructive sleep apnea. We really should be getting to the children, right? And that's exactly what my wonderful colleague, Dr. Joanna Green, is doing over at the Center for Airway and Facial Development. She is doing wonderful things there. She is evaluating children. She is helping them grow and develop properly, okay? So they won't have to see me when they get older. So I just want to show you, this is just one child that she treated. I mean, you can see right here, he presented with, snoring, grinding, just, very hyperactive. He wasn't doing really well, just, always, I guess, in a bad mood, right? If you're not sleeping, I mean, it kind of makes sense, but look at his mouth. He was starting to develop a very small jaw set, right? So she was able to, evaluate his tongue, get his lip tie dealt with. She got him into myofunctional therapy. I mean, look at the difference of just his face. I mean, he's sleeping really, really well now. So, we have to get these kids evaluated by someone like Dr. Green. So don't get a sleep divorce. So if you are local and you are currently in a sleep divorce, or you recognize any of these things that I talked about, I would love to evaluate you, to take a peek at you. If you're not local and you need some guidance on where to go, or if you have any questions, you are more than welcome to email me, and I will be happy to help guide you. So these are two books that I highly, highly recommend. The Root Cause was written by my partner, Dr. Ryan Robinson, and he really just goes through the different cases that we see on a daily basis. And then, of course, James Nestor, his book is just absolutely amazing, and you can buy them both off of Amazon. So sleep is the single most effective thing we can do to reset our brain and body health each day. And that's little Matza again. I know he's mouth breathing, but that's okay, because you just have to nasal breathe about 96% of the day. So I really appreciate you guys listening to me, and I hope you found it helpful.
Thank you so much. We do have a couple questions.
Oh, sure.
And I will drop your email address in the chat as well.
Okay, perfect.
Why does sleep apnea make you have to go to the bathroom more often at night?
Well, it depends, because, if you're not getting that deep level of sleep, you're going to have your hormones not get like regulated properly. And a lot of people think that it's going to the bathroom is what's waking them up, but it's actually their obstruction that's causing them to wake up, and then they realize they have to go to the bathroom. So it's one of those things that you have to kind of look at, especially with a sleep test. It will show you the percentage of deep sleep that someone is getting, and it will also show how many times they're spiking out of the different sleep stages. So usually that can be a good indication of like, okay, so you're having an obstruction happening, cortisol is being released, right? Your body is like, you got to get up. So then people wake up, but they don't know that it's their airway. So then they're like, okay, well, I'm awake, I have to go to the bathroom. Okay, so there's multiple factors that could be at play, but that's really the one typical, what I see in my practice, the typical reason. So I hope that makes sense.
And then how quickly can we have a virtual consultation scheduled? My husband and I sleep in different bedrooms because of snoring.
So yeah, that's a great question. So when someone calls our practice, we're able to get them on a free 30-minute virtual consultation. And from there, we kind of look at, the symptoms, what you guys, what you're looking for. And, we look at the urgency, and we definitely hold slots for people that need to get in soon, because we do take this very seriously. So we don't want people waiting, weeks to get in to see us.
I will also drop the phone number into the chat as well, for the office. I have a CPAP, which is very effective. However, I still have jaw pain. Can an appliance be worn with a CPAP?
Oh, absolutely. I actually do co-therapy a lot. I have patients that they wear a CPAP and they love it, and it's doing so well for them. And my goal is not to get people off of CPAPs. If they're wearing it, that's great. But adding an oral appliance, especially if they're still clenching, grinding, or having some jaw pain, they work really, really well together. You just have to make sure that you're in the right appliance.
Okay. Then I have a mouth guard that I try to wear, but every time I do, I wake up with it on my pillow. Could this be a sign of an issue?
Absolutely. I actually see that a lot. And what's happening is we were talking about how everything is fighting for that space, right? The soft palate, the tongue, the back of the throat. If you put a night guard in your mouth, you just pushed everything further back into your airway. So depending on someone's size of their throat, depending on the size of the jaw, a night guard can make an airway issue worse. Okay, so that's why someone's taken their night guard out at nighttime. Great questions.
And then, it's not a question. My husband snores, but his lips are closed. He has asthma. Let's just I'm just looking through the chat. Don't see any more questions. I did drop all of Dr. Jacobs' information and Pain and Sleep Center, Pain and Sleep Therapy Center's information in the chat as well. So if you have any questions, you can email her and get in contact with them. And if not, thank you so much, Dr. Jacobs. This was very informative.
Yes.
Thank you everyone for joining us tonight. We hope you have a great evening.
Yeah, you're so welcome. Thank you so much.
Thanks everyone. Have a good one. Bye.